So another question I wanted to ask, you're talking about the booster shots. That seems like that's been put aside. When they do become available, I think they're available now, it's going to be for 65 and older and some select groups. But COVID in general, what we've gone under with this pandemic, you know, now we're surpassed the pandemic of 1918 in numbers of deaths. Isn't that incredible? Over 600,000 in this country. 1 in each 500 Americans has died from COVID. That's unbelievable to me. What do you think the future of COVID-19 is for humanity?
Yeah, so I mean, I guess time will tell. We don't really know, but there's a lot of opinions out there. I mean, it seems like at this point, quote, COVID-19 won't go away. As far as what it's going to look like, what the picture of it's going to look like, it just so much of it depends, and like the timing of that depends. Ideally, we could have all had mass vaccinations. We could have truly flattened the curve, reduced the spread to really get in control over it, but that has not happened yet. That would have been a whole different outlook, but that hasn't happened, right? And so the longer the virus goes around, we have more and more mutations. These mutations always give the virus the benefit, not the humans, right? So it's more scary. And so we don't know what's to come. But like right now, the Delta variant causes much more severe disease. You're more likely to have to be admitted. It's looking like it's also going to be a higher actual mortality, like a death rate as well. And so with the future, it's going to look like it might keep getting worse and worse. Some of us think, though, that over a certain period of time, we don't know if that's a year from now, 5 years from now, hopefully at a certain point we will reach herd immunity, be it vaccinations or natural immunity. If we reach it through natural immunity, many more people will die before we reach herd immunity. But once that finally happens, it's not that COVID goes away, but it won't be the severe disease anymore. So once that happens, we will hopefully down the road look at COVID like all other coronaviruses that have been around for a lifetime, for longer than a lifetime. And we'll look at it like a common head cold, a nuisance, a bother, and nothing serious. But that's not happening anytime soon is the problem. And what's the gap between now and when that does happen, when COVID's nothing, when it's no big deal? How many more lives are going to be lost? Is it going to take another a million American lives to get there? What we know is that we can get there with less deaths if we keep vaccinating. We'll get there one day with natural immunity, but it would be at the cost of more and more American lives. And so what are we going to do about that? It's not going away. It's not going away. One day we will see light in the tunnel. I just don't know what path we're going to be on to get there.
Well, again, thank you for everything you're doing. And I would like to say that if you want to take a rapid test, I took a rapid test this weekend, and you just drive through and you can get an app on your phone, which is My Chart, and Southeastern Health has it, Scotland Health has it, and you can have this My Chart as you go through and take your rapid test, and you don't have to wait, it just comes up on your phone. Yes. And you should have this My Chart for anything that you have, because you have a record on your phone, your complete medical records, every medication you're taking or being prescribed to, notes from your doctor, because we're in a virtual world now. Sometimes I can't get an appointment to come in and see and talk to you or anyone else, but I can text to My Chart and get answers to my questions if I'm a patient. So this is really critical, and we need to do more of this. Our people need to take advantage of this. And young people, I know that it's easier for them, but we should teach everyone how to do it and take advantage of it.
I agree.
The other thing is, I'm wearing a Corps mask today, of course. So Linda Oxendine was head of Corps here in Robeson County. She's been called down to Louisiana for the hurricane, and I don't know how long she's going to be down there. We need her here. But please go on the Lumbee Tribe Facebook page. We're still testing every day, drive-through testing every day. And we're also vaccinating on Tuesdays. I think it's like from 3 to 6, but please check the Facebook page for these important times and dates that we do these things for our people. Also, I want to thank you, and I want to say this publicly to anyone who has been a part of these videos. I know it's a grind, and sometimes you don't feel like you're being effective, but everything that we do like this, everyone that participates in something like this, especially through the tribe and what the messaging we're trying to get out, you're saving lives. Even if it's one life, our Lumbee people it's not just the 65,000 is the one life. We got to care about the one life. And I think what we've been doing and what you've been doing and all the other medical professionals and ministers and everyone that's been involved, you're looking after that one life, which will affect us all. So God bless you again. Thank you all. And just keep in mind, if you're not vaccinated, please, please, please consider being vaccinated. Thank you.